In this webinar, we shall learn about oxygen analyzer. Oxygen is the most commonly used drug in the neonatal intensive care unit. Inappropriate oxygen therapy affects the outcome of neonates. Too little oxygen or hypoxia results in higher mortality and adverse neurodevelopmental outcomes. Too much of oxygen results in retinopathy of prematurity and bronchopulmonary dysplasia. Hence, oxygen analyzer or FiO2 monitor is desirable, which helps in analyzing oxygen concentration delivered to the babies. Let us study about the equipment. Oxygen analyzer measures the concentration of oxygen in the inspired air. It has a galvanic cell and a sensor. Galvanic sensor is an electrochemical sensor which is a small partially sealed cylindrical device that contains two dissimilar electrodes immersed in aqueous potassium hydroxide solution. Let us study the principle of oxygen analyzer. As oxygen diffuses through the semi-permeable membrane installed on one side of the sensor, the oxygen molecule at the cathode gets reduced to form positively charged hydroxyl ion. This hydroxyl ion migrates to the sensor anode where an oxidation reaction takes place. Oxidation reduction reaction generates electric current proportional to the oxygen concentration in the sample gas. The current generated is measured and conditioned with external electronics and displayed on a digital meter in percentage. For calibration, one should switch on the oxygen analyzer and the sensor should be exposed to the atmosphere. Ideally, the displayed value should be 21%, representing the concentration of oxygen in the atmospheric air. If it does not show 21%, then the control knob is rotated so that it reads 21%. The instrument has an accuracy of plus or minus 2%. Let us study how to use oxygen analyzer. After calibration, place the sensor in oxygen hood away from the oxygen inflow end of the tubing whose concentration is to be measured. Wait for 5 to 20 seconds, as this is the usual time between the placement and detection of the reading. This time is also called as response time. Then read the displayed value, which is the concentration of oxygen. Let us study what are the precautions while handling the oxygen analyzer. Do not pull or bend the sensor, as this is the most important and extremely fragile component of the equipment. One should always calibrate the equipment before each measurement. Do not leave the oxygen monitor stored with power switch on. Sensor fluid will freeze at low temperature and ignite at high temperature. Hence, avoid high or low ambient temperature where the oxygen analyzer is kept. Thank you.